Welcome to our new webinar series entitled Getting Reimbursed, Updates on Billing and Documentation for Psychological and Neuropsychological Testing. My name is Nicole Owings-Fonner and I'm in the Communications Department here at APA. This webinar is a little bit different than some of our other webinars in that we are not airing it live and we are dividing the content into sections that will be more manageable for you to view, watch, and find exactly what you're looking for. This series will be presented by Dr. Jared Skillings, an additional APA staff, Dr. Antonio Puente, Dr. Neil Pliskin, Dr. Stephen Gillespie, and Dr. Micah Westerfeld. Our objectives for this series are to provide you with an update on APA Services, Inc.'s advocacy efforts related to testing codes, to briefly review the testing codes and definitions, to address major billing and documentation developments. We'll also discuss how to document your work and demonstrate how to apply the new codes using expanded practical examples. Lastly, our experts will provide responses to the most frequently asked questions that you've submitted.
So a question pertaining to documentation of testing evaluation services. Is there a recommended form, worksheet, or format to document and track the cumulative time required to perform each service and the corresponding CPT codes that are billed for an episode of care? Next slide. Let's use a typical case example well familiar to adult neuropsychologists. A 58-year-old male with a history of diabetes and hypertension presents with a 6-month change in behavior, personality, and cognition, and a positive family history of Alzheimer's disease. For these reasons, his physician refers him for neuropsychological testing to establish whether the patient has any suspected mental illness or neuropsychological abnormality or central nervous system dysfunction. Now, evaluations like this can take place over a single day. Evaluations like this can take place over multiple days. And even if the evaluation takes place over a single day, the work, non-face-to-face work, can take place over multiple days. So how can you capture this information in a way that's clear? And so here is an example of a billing services summary. And in this scenario, we're going to say that the neurobehavioral status exam and the neuropsychological testing, along with some professional test evaluation services, took place on day 1. But in this scenario, we will have our clinician providing services on day 2 and day 3. And some of those services will be face-to-face and some will be non-face-to-face. So how to record this in a way that makes it clear. Here's an example. So if you look to the right side of this slide, the very first thing that would typically occur in an evaluation is the neuropsychologist, in this case, would be handed a file, an intake sheet, something that details the patient's intake information and a reason for referral. And if there is no reason for referral, the neuropsychologist might take some time to clarify that referral question. All of that takes place before a decision is made about which tests to give. In fact, it's the record review and the clarifying the referral question that helps the clinician to make some of those initial determinations. And so you'll see in the middle section there, under the neuropsychological testing evaluation services, the very first line says record review and clarifying the referral question, date day 1. That took 5 minutes. That was 5 minutes of your professional time using your professional expertise to make some initial clinical decisions. Now, in a typical evaluation, then you might start off after doing your pre-service record review and clarifying the referral question. You might then start off doing a neurobehavioral status exam / clinical interview. And in this example, we see that the face-to-face interview takes place from 9:15 to 10:25. If you look at the top section there under neurobehavioral status exam, it's listed. And then in parentheses, you would list that date, that first date that you're providing that service. And after the face-to-face neurobehavioral status exam is complete, then you might take several minutes in this example to document the neurobehavioral status exam results. And you see that represented also in the top section there under documentation from 10:25 to 10:30. Now, when you are doing your clinical interview in this example, the patient and or family member has some distress or concerns in the context of the evaluation that requires symptom management. So in this scenario, it might be the identified patient, the 58-year-old male might say, what am I doing here? And why should I have to stay for testing? So that might necessitate spending, in this example, 15 minutes not engaged in testing, but using your professional expertise and background to manage the patient's symptoms to get them to a point where they will be able to do testing. So that's reflected in the second section there, patient symptom management, 10:30 to 10:45. I mean, the point is that if you're engaged in professional service activities, you should be recording them and capturing that time because that is part of the service that you're providing. So we have from 10:30 to 10:45 on day 1, there's the patient symptom management, and you see that's recorded in the middle section there. Now, before you've conducted your clinical interview, you've made some preliminary clarifications of what the test battery is going to be. Now, based on what you've learned in the clinical interview and neurobehavioral status exam, you've decided that you need to modify your battery. It might be that during the clinical interview, you discover that the patient or the family members are concerned or describes behaviors that might reflect, for example, more behavioral disturbances rather than memory disturbances. So therefore, you might have to decide based on your neurobehavioral status exam that you're going to incorporate measures of executive functions into your battery. Well, that takes time for you to make those modifications and clinical decisions. And that's also reflected in the middle section there under clinical decision making, battery modification, 10:45 to 11 a.m. on day 1. Now, there will be some patients where you won't be doing much clinical decision making and the battery will be straightforward. There might be some patients where you might not have to intervene and do symptom management, and then you won't be recording those. But the point is that if you engage in those behaviors, and it's typical as services, and it's typical for psychologists and neuropsychologists to do this, then you need to capture that time and capture it in a way so that as I'm going through chronologically here, I'm describing each and every activity. And so if you look now to the bottom section, test administration and scoring, by 11 a.m., I'm now ready to conduct my test battery in its entirety based on the information and modifications that previously had been made. So the test administration face-to-face goes from 11 until 12, and I'm looking again at the bottom section labeled Test Administration and Scoring by Psychologist, and then proceeds on after a lunch break from 1 until 4 in the afternoon. And when it comes time to document this, I'm documenting it with start and stop times, as you see here, and I'm listing in parentheses the date of service. Because as we've said up front, there's going to be multiple dates of service. We're now dealing with day 1. By 4 o'clock, the patient is ready to go home, the evaluation is complete, and the psychologist or neuropsychologist returns the next day to engage in further services. And that might be coming in the next day, whatever day that would be, day 2 that you provide the service. And in this example, the psychologist engages in scoring all the tests that were administered by her or him the day before, or the session before, whenever that is. And that scoring takes place from 9 until 11 on day 2. And that's where it's documented in that section with start and stop times. Now the psychologist and the neuropsychologist have conducted the neurobehavioral status exam, so they have all the behavioral and interview information they need. Now the psychologist has the actual test scores in their possession. Now the provider sits down with that information plus the records that may or may not be present and available for review, and takes all of that information, the behavioral information, the collateral contact information, the medical record information, observations made during the day, and the psychometric test scores, the psychological, neuropsychological test scores, and integrates them and formulates opinions about them, which are generated in a report. And in this example, that report generation and integration takes place from 11 a.m. until 2 p.m. on the second day that service is provided to that patient. It's grouped within the second section, neuropsychological testing evaluation services, but it takes place on a separate day. And again, it is not face-to-face activity. So now by 2 o'clock in the afternoon, on that second date, the report, the integration is complete and the report is generated. On the third day that an individual now is providing these services, in this case, the patient and family member come back to hear about the test results and to engage in interactive feedback. Now, as you can imagine, and some of you, of course, have been in this position, telling a 58-year-old individual and members of their family that their loved one has Alzheimer's disease, shows beginning stages of Alzheimer's disease, or maybe has a different type of dementia that is commonly occurs in their 50s, like, for example, frontotemporal dementia. These are not brief, here are what the test scores show. These are interactive feedback sessions. And using our training as behavioral health providers, we're delivering the interactive feedback. We're helping the patient and the family understand the implications of those feedback, of those test results, and we're presenting them with the next steps, where to go from here, what the treatment plan should be, what the interventions should be. In this example, this type of interactive feedback session certainly takes more than 31 minutes, and in this case it takes 60 minutes. It goes from 9 a.m. till 10 a.m. on day 3. And if you look in the second section there, neuropsychological testing evaluation services, towards the bottom of that second section, you see interactive feedback session 9 to 10. And now in parentheses, you're listing a third date of which service was provided. Now this service is face-to-face. So now you've provided your interactive feedback session, you've delivered a copy of the report to them, and now you need to take the report and upload it into the medical record, or put it in an envelope and send it snail mail to the outside referral source, or pick up the phone and call the referral source and let them know about the results. That's all considered post-service work. In this example, that post-service work is grouped under the second section, neuropsychological testing evaluation services, because this is the professional service you're providing. You're engaging in 15 minutes of that post-service type of work, and you're recording in parentheses there the date of service. So in this example of our 58-year-old, in sum, services are provided across 3 days. They're divided into neurobehavioral status exam, the professional testing evaluation services, and the test administration and scoring by psychologist services. Some of these activities are face-to-face, some of them are non-face-to-face. But by recording start and stop times, by providing enough detail to note what the service is that you're providing, you are documenting clearly all of your professional activities. And while this appears to be a more labor-intensive way of managing things up front, it will pay dividends by making it much easier for other individuals who review these billing services summaries to understand exactly what you did and when you did it.